Hello everyone. Today's video is another Q&A video talking about methylene blue, biofilms, and heavy metals. Just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please ask your healthcare provider to provide that advice for you. So there were a few different questions, and I thought I'd just cram them all into a Q&A video. Getting quite a few questions on my videos lately. So the first one is about heavy metals. So it says if a baseline heavy metal test, so a urine toxic metals test, I presume, read 0.97 for lead, and then a post urine toxic metals test, so like presumably after a chelating agent like DMSA or EDTA or DMPS, so the lead came up at a 51.5, or there was a 2.6 baseline for mercury and a post-chelation of 10 for mercury. It says, what would that indicate to me? And could a huge exposure a decade ago still be in the body? So thank you for the question, and obviously the question's just being asked entirely academically because, of course, I say in all my videos I can't provide any medical advice, but just sort of at face value, what would those results mean to me? So I mean, just to answer the last question first, exposure from a decade previously to a human being could absolutely still lead to heavy metals still being in the body. The body has a really hard time getting rid of heavy metals. Evolutionarily, we were designed to get rid of heavy metals. We have these special proteins in our bodies called metallothioneins, and their main job, maybe their only job, I'm not sure if there's other jobs of metallothioneins, but their main job is to help flush heavy metals out of our cells, because as human beings, we are, so say go back, 200 or I don't know, 400 years or something like that, before the industrialization of the planet, or even actually wait, maybe even way prior to that, before, as a species, we started burning coal and various other things for, heat and supplying energy for things. Back when we were just kind of running around, trying to avoid predators and hunter-gatherers and this and that, even at that time we were exposed to heavy metals, because whenever there's, say, volcanic eruptions, that spews all this content from the Earth's core, including heavy metals and various other things, that sediments into the waterways, etc. And there's a bit of heavy metal exposure out there, just out in nature, and so our bodies are developed these mechanisms to help cope with getting rid of and flushing out those heavy metals. Unfortunately, just over time, as our species has dumped more and more heavy metals into the environment, and thankfully there are measures in place where we're not doing that as much as a species anymore, but it still happens, and there's still the contamination from decades gone by. Our cells have just not been able to, like, evolution just can only go so fast. We have not evolved to be able to flush out heavy metals, exponentially more, because even though there's been an exponentially greater level of exposure for our species nowadays. So long and short of it is that when we're exposed to significant amounts of heavy metals, even if there's not a huge whopping exposure, the day-to-day exposures that we have can absolutely bioaccumulate over time. And I say that with a high level of confidence because we do heavy metal tests on folks all the time, and we find elevated heavy metals. So in my opinion, to my knowledge, in my experience, we can absolutely accumulate metals, and so especially if there's a huge exposure many years ago, it could absolutely still linger for 10 plus years later. When I see heavy metal test results and I see a low result, and I mean, the relevance of different results really depends on the reference range of the lab in question. So, the lab that we use, Doctors Data, based out of Illinois, I have no financial affiliation with them. I just really like the lab. We've been using them for a long time. They're a well-priced lab. Their reference range for mercury would be, should be less than a 1.3 for a baseline. And so what that suggests or indicates is that if a baseline level is below that, it suggests that there's not an excessive amount of ongoing day-to-day exposure to that particular metal. So it would suggest that the person doesn't have too much lead in their drinking water, or they're not eating too much tuna and getting too much, say, mercury that way, or they're not eating too much shellfish and getting too much arsenic or cadmium that way, or whatever it happened to be. So when I read a baseline result, it gives me insight into whether or not my patients are being exposed to excessive amounts of metals. When I see a baseline, say arsenic, that's really high, it tells me, oh, there must be too much arsenic in the groundwater that person is drinking. When I look at the post-chelation results, that's where the kind of opinions and clinical experience might differ a bit from clinician to clinician. And some folks will say that we don't want to see more than a 10-fold elevation from the baseline level in the post-provocation level. So in other words, if I had a baseline level of lead that was, say, like at say a 0.5, some clinicians would say, well, 0.5 times 10 is 5, so we don't want to see anything higher than a 5 on the post-chelation. That's a fairly liberal way to be looking at the level of exposure, because quite frankly, if you have a low enough baseline, then almost anybody's going to have at least a 10-fold elevation compared to baseline. Whereas other clinicians, other standards out there are that you want to look at the reference range for the metal in question and multiply that by 10 for the post-chelation cutoff. So say for doctor's data, for say mercury, we want, so it should be less than a 1.3 baseline. Well, then 1.3 times 10, of course, is 13. So then some folks would say, well, it should be less than a 13 post-chelation when we're actively using a chelator to try to flush the metals out of the cells. So in terms of like, how are we reading, or what is the relevance of post-chelation results being elevated compared to baseline results? We're always going to see higher levels post-chelation. I say always, I mean, it's not always the case, but it's almost always the case. There are certain circumstances where we don't see that. We see the baselines higher, but in terms of like clinically relevant results, indicating tissue accumulation, we're always going to see elevated level, almost always see elevated levels of these metals in the post-chelation result. It's just a question of, has it elevated significantly enough? So again, that does differ depending on there's different opinions out there about that. There's no consensus, and unfortunately this is an area that's, in my opinion, like really understudied. So we just don't really have the definitive studies that have been done showing that, like, okay, what is the right answer? Should it be multiplying from the baseline amount? Should it be a 5 times multiplier for the upper limit of normal for baseline, or for an unprovoked sample rather? Should it be a 10 times multiplier? Should it be a 15 times multiplier? So there's different opinions out there. So in my practice, I usually, I do, for years, I've used the 10-fold multiplier. So whatever the baseline cutoff or the unprovoked cutoff range is, I'll just multiply by 10, and that's the cutoff point. And I feel like in clinical practice, that's played out really well, because what I've seen is that if folks have levels less than that 10-fold multiplier, it's very rare that it's clinically relevant. And then when we do have folks who have really elevated levels of lead or mercury or whatnot, and then we do use chelation therapy to help bring those levels down, then typically once we get somebody down to below that 10-fold multiplier cutoff point, so say 13 for mercury in this case, then typically we don't see any additional clinical benefit as we go lower than that. So I hope that was of use to the person who asked the question, and of interest to anyone else who was watching the video. As I'm looking at the time here, I really thought I'd get through these other questions, and I did not. So I am going to change the title of this video to just heavy metal result interpretation. But if you didn't see that title and you heard my intro saying I'm going to talk about methylene blue and biofilms, my apologies. I am not going to in this video. I'll talk about them in the next video. So if anybody has any questions on this topic or anything else, I will do my best to answer them as soon as I can.